New drugs are proving highly effective in helping overweight Americans drop unwanted and sometimes dangerous pounds. Statistics show 4 in 10 U.S. adults are considered obese, which puts their health at risk. So it's no surprise weight loss drugs like Ozempic are all the rage. Medical reporter Lori Johnson takes a closer look at this trend and tells us why some doctors are warning buyer beware.
Katie Schottman is one of 12 million Americans currently taking one of these GLP weight loss drugs.
I've lost about 50 pounds, and it's been life-changing for me.
Along with a renewed sense of confidence, she feels no longer addicted to sugar.
You don't even want it, so it's not something you crave, oh, I need a piece of chocolate or something like that. You don't have that craving anymore.
Katie's results appear typical as patients average losing 10 to 20% of their body weight.
Some people cannot control their appetite.
Dr. Don Colbert sees the drugs as especially helpful for those dealing with obesity and type 2 diabetes.
These GLP-1 receptor agonists lower insulin levels, so eventually that appetite it puts it out. You're not being controlled by your appetite.
That's because these drugs can mimic natural gut hormones that target brain receptors, which can communicate messages and changes to the body.
Ozempic turns off one key appetite hormone. Mounjaro or tirzepatide turns off 2 key appetite hormones. And then the new one's coming out, the retatrutide, which comes out probably next year, turns off 3.
In addition, patients experience slower digestion.
So food sits in the stomach longer, and so you feel fuller longer.
Katie's weight loss led to other health improvements.
My A1C has gone down a lot. As far as my cholesterol, that has gone down. My heart rate is actually even slower now. Another big thing that probably a lot of people would appreciate is people who snore. No more snoring. It completely went away.
Other benefits can include lower risk of heart attacks, strokes, sleep apnea, or kidney disease. A Cleveland Clinic study also showed GLP-1s reduced the risk of progression of breast, lung, liver, and colorectal cancers by up to 50%.
Patients that are on GLP-1 receptor agonists and have early-stage cancer shouldn't be as worried about that stage 4 progression.
This drug class often lowers inflammation, which has been found to minimize joint pain and effects of Alzheimer's disease. While the benefits of GLP-1s are many and seem to be growing by the day, there are a number of red flags. Those include various side effects such as nausea, constipation, and acid reflux. Patients also often notice temporary bouts of fatigue when starting the drug. Doctors note less common side effects that can be more serious, including pancreatitis and gallbladder problems. GLP-1 users are also advised to consume at least 90 grams of protein daily or risk muscle or bone loss. Demand for these successful drugs means the search is on for cheap, easy-to-obtain versions. That's turned the online marketplace into what Dr. Matthew Knight calls the Wild West.
If you spend any time on social media, you'll see a ton of these ads aimed at consumers.
They usually promote copies or custom mixed versions of the drugs, which are not FDA approved.
It really is up to the patient, up to the consumer to verify, who's compounding it, what's their track record. Do you know where it's from? I mean, is it from the United States or is it from out of the country? Is it pure? Does it have other things in it?
Knight advises the better approach would involve supervision from a healthcare professional.
You need an exam. Somebody needs to know what other medications you're taking. Somebody needs to follow your progress. And you also need an exit plan because at some point you're going to stop taking these medications and you need to know what's going to happen then.
GLP-1s are available in pills or shots. Katie has received an injection once a week for the last 2 years and is ready to start tapering off the drug. That will happen with the help of her physician, Dr. Joanne Lopes.
And gaining some weight back is fine, but you just don't want to get back to the point that you were before you started the GLPs. It goes back to changing that behavior. So not relying just on a medication to help you keep that weight down. You still need to learn better eating habits healthier eating habits and implementing exercise into your lifestyle.
So, Andrew, while maintaining your weight after going off these GLP-1 drugs is possible, studies show that within 1 year, most people gain back 2/3 of the weight they lost. So what people are saying is now is, well, maybe I'll just be on it indefinitely. And is that such a bad thing? Well, they can give up their cholesterol medicine that they were going to be on indefinitely, their blood pressure medicine that they were going to be on indefinitely, and on and on. So, you know, it's kind of like, you know, what is more important?
Appreciate you doing this story. It's important. As mentioned, a lot of folks are on it or considering it or maybe trying to wean off. So what about, you talked about these copycats. So how can people find, if they're interested, affordable, FDA-approved version?
Right. So one great place to look is TrumpRx.com. This is the Trump administration actually made deals with these drug producers of the FDA-approved drugs, and you can get them at deeply discounted prices. Now, you can't use insurance. You pay out of pocket. But go to TrumpRx.com. You do need your doctor's prescription, but that's a good thing. And then, Andrew, Medicare is going to start covering GLP-1 starting July 1st. They've already been covering it for type 2 diabetes, but now they're going to be covering it for weight loss. So Medicare, again, you need a doctor's prescription. Talk to your doctor about it.
So some people find this good news that it also helps fight addictions on occasion.
Yes, indeed. And now there is scientific proof. For years, people on these GLP-1s have been like, wow, I was taking it for type 2 diabetes, but I finally was able to quit smoking. Or I was taking the GLP-1 to lose weight, but yay, I can finally quit drinking. So a new study just out of WashU Medical Center in St. Louis showed that people with other addictions, alcohol, nicotine, cocaine, opioids, marijuana, people on GLP-1s had less of a propensity to become addicted to these substances, and people already who were addicted to them, if they were on GLP-1s, they had fewer incidents like hospitalizations and overdoses. And scientists say it's because these drugs target these biological pathways that underlie addictions. Cravings, the GLP-1 receptors in our brains that talk about reward centers, that it lessens the craving. And you can hear people on GLP-1s saying, yeah, I don't have that food noise anymore. I don't have that noise where I'm always wanting this certain drug. It's about cravings. It's
an interesting point about all this. And of course, we're not a proponent of, hey, I want to give up an addiction, so I'll get on this. But it's an interesting topic in all of this. What about this microdosing?
So microdosing, as the name suggests, is just a little bit. And so some people are microdosing now, and it's, you know, there are pros and cons to it. The biggest con is that it has not been scientifically studied. So you take a little bit, but some doctors like it because there are oftentimes some GI problems that people experience. And if you start off small, then you can see if you're having problems like this, or they can be less. And then also for people who are weaning off these drugs, sometimes you can microdose and have a little bit once a month rather than just going cold turkey. And they're cheaper. It's a cheaper process.
Am I correct, Ozempic and other GLP-1s, the weight loss is really a side effect. It wasn't designed for weight loss, correct?
Yeah, that's right. And so many drugs are this way too, where it was created for one thing, but then one of the side effects was something else that people really like. So yeah, it was actually created to lower blood glucose levels for people with type 2 diabetes. But now it is FDA approved not only for type 2 diabetes, but also weight loss and cardiovascular problems.
Finally, do you have any counsel for people who, because there's benefits and also some negatives, do you have any counsel for people who are considering this?
Absolutely. Talk to a medical doctor about it. Boy, you can really get those cheap, easy to find versions because everybody's out trying to make a buck. And they're all over social media. You can see them everywhere. People advertising the GLP-1 weight loss. You got to go to a doctor and get that prescription and talk to a medical professional.
All right.
Don't do it on your own. You can do it on your own, but who knows what you're getting.
Okay. Good counsel. All right, Lori, thanks so much for being